Chapter 16 Exercise Prescriptions for Health and Fitness. Exercise Physiology. Theory and Application to Fitness and Performance, 6th edition. Scott K. Powers and Edward T. Howley. Presentation revised and updated by Brian B. Parr, Ph.D. University of South Carolina Aiken. Introduction. Physical activity. Physical fitness. Exercise. Any form of muscular activity can reduce the risk of death from all causes. Physical inactivity is a primary risk factor for coronary heart disease. Physical fitness. Set of attributes that relate to ability to perform physical activity. Exercise. A subset of physical activity that is planned, with the goal of improving or maintain fitness. Prescription of exercise. Dose-response relationship. The effect, response, of the amount of a drug, dose. Potency. Relatively unimportant characteristic. Slope. How much change in effect comes from a change in dose. Maximal effect. Efficacy. Variability. Effect varies between and within individuals. Side effect. Adverse effect. The relationship between dose of a drug and effect. Figure 16.1. Pattern of responses to exercise. Acute response. Occur with one or several exercise bouts but do not improve further. Rapid responses. Benefits occur early and plateau. Linear. Gains are made continuously over time. Delayed. Occur only after weeks of training. Dose-response. Exercise dose is usually characterized by intensity. Percent VO2 max. Percent maximal HR. RPE. Lactate threshold. Frequency. Number of times, or days, per week. Duration. Number of minutes. Total kcal expended. Type of activity. Resistance and endurance exercises. Dose-response relationship for exercise. Figure 16.2. Physical activity and health. The health benefits of physical activity. More related to total number of calories expended than exercise intensity. Benefits depend on baseline activity level. The ACSM/CDC recommendation. Every U.S. adult should accumulate 30 minutes or more of moderate intensity, 3 to 6 METs, physical activity on most, preferably all, days of the week. This is minimum for achieving health outcomes. Additional activity, including vigorous exercise, provides additional benefits. Dose-response relationship for physical activity and health benefit. Figure 16.3. General guidelines for improving fitness. Screening. Health status screening, Part Q. Risk of cardiovascular complications is related to degree of pre-existing cardiac disease. Progression. Moderate intensity walking, 3 to 4 miles per hour. Then increase duration and or intensity. Walk/jog. Warm up, stretch and cool down, stretch. Light exercise and stretching performed at beginning and end of exercise session. Exercise prescription for CRF. Frequency. 2 to 4 sessions per week. Gains level off after 3 to 4 sessions/week. Duration. Total work/session should 200 to 300 kilocalories. Must be considered with intensity. Intensity. Describes the overload needed to bring about a training effect. 60% to 80% of VO2 max. Lower in those with low initial fitness level. Target heart rate range, intensity, duration, and frequency of exercise and VO2 max. Figure 16.4. Determining target heart rate range. Direct method. THR range determined from maximal GXT. HR at 60 to 80% VO2 max. Indirect method. Heart rate reserve, Karvanen, method. Subtract resting HR from maximal HR to obtain HRR. Take 60% and 80% of HRR. Add each HRR to resting HRR to obtain THR range. Percentage of maximal HR. Take 70% and 85% of maximal HR as THR range. Use RPE scale in addition to HR. RPE of 12 to 16 is about 40-50 to 85% HRR. Target heart rate range determined from GXT. Figure 16.5. VO2 reserve, VO2R, VO2 reserve. Difference between VO2 max and resting VO2. Percent HRR more closely linked to percent V.O. 2R than percent V.O. 2 max. Greater difference for those with low fitness level. Calculating target VO2. Take 60% and 80% of VO2R. Sequence of physical activity. Walking. Start at a comfortable speed for 15 minutes. Gradually increase duration and speed. Jogging. Start by adding some running when walking. Gradually increase speed/duration of running. Games and sports. Intermittent higher intensity activities within THR range. An example of a walking program. Table 16.1. An example of a jogging program. Table 16.2. Strength and flexibility training. Muscular strength and flexibility are important components of a complete fitness program. Recommendations. Dynamic resistance exercises. Full range of motion. 8 to 10 different exercises. 8 to 12 repetitions per exercise. Physical activity pyramid. Figure 16.6. Strength training ACSM recommendation, single versus multiple sets. 1 set of 8 to 10 exercises. 8 to 12 reps per set. 2 to 3 sessions per week. Single versus multiple sets. 1 set to achieve health and fitness goals in average individuals. Multiple sets for increasing strength in train individuals. Maximal strength gains. 4 to 8 sets at 60 to 85% 1 RM, 2 to 3 days per week.